Hello everyone, my name is Cynthia Hernandez and my topic for this course is Hepatocellular Carcinoma. I chose this topic because it's something I observed during my MRI rotation. When I saw this on the MRI, I thought it was pretty cool and I thought I should share it with the class. In this presentation, I will discuss the description of hepatocellular carcinoma, what causes it, what the role of imaging has to do with this pathology, the primary modality, and any other modalities related to this pathology. I will also show you the images that I saw during my MRI rotation. And lastly, I will discuss the treatment and the care and prognosis. The most common primary liver cancer is hepatocellular carcinoma. The liver is the largest organ in the body. It is located under the diaphragm in the right upper part of the abdominal cavity, which sits on top of the stomach as well as on top of the right kidney. The liver plays an important role in the body. It breaks down and stores nutrients. It makes bile, which helps absorb nutrients in the intestine, and it also helps get rid of waste. We've all taken medical terminology, and if we break down the name hepatocellular, it means pertaining to the liver cells, and carcinoma is cancer in the epithelial tissue. Hepatocellular carcinoma is cancer that originates from the cells of the liver, which this means this tumor started from the liver and it didn't come from somewhere else. This liver cancer is the third leading cause of death from cancer throughout the world. It's also the ninth leading cause of cancer deaths in the United States. It's 2 to 3 times more common in men. Hepatocellular carcinoma is caused by individuals who have long-term liver disease such as hepatitis B infection and hepatitis C infection. Hepatitis is inflammatory disease of the liver. Hepatitis B and C can be transmitted sexually, perinatally, or by used equipment like syringes and needles that have been used for a patient. An example could be exposed from a needle stick of a patient. Perinatally means that a pregnant woman can give her baby hepatitis. It's also common in people who abuse alcohol, which is excessively drinking alcohol, which could then lead to cirrhosis and liver cancer. Liver cancer could also be caused by a large amount of fat in the liver. Out of all these causes, hepatitis B is the main cause for hepatocellular carcinoma. Here are some indicators and tests pertaining to hepatocellular carcinoma. Starting with symptoms associated with this disease, some signs may be fever, weight loss, abdominal discomfort, nausea or vomiting, persistent itching, and jaundice. Jaundice is where the skin turns yellow and the eyes turn white. Experiencing these symptoms for more than 2 weeks could indicate hepatocellular carcinoma, and you should contact a gastroenterologist. After stating your symptoms to your doctor, the next step is to perform tests to find out what's going on and why you are experiencing these symptoms to confirm you have this disease. A couple tests that could be performed to confirm this disease are blood tests to measure liver function, imaging tests such as MRI, CT, ultrasound, and any other modalities that can help diagnose and treat liver cancer. The last test that can be performed is a liver biopsy, which is a procedure where the radiologist will take a small amount of liver tumor tissue and will have the medical lab scientists perform a test to see if the tumor is cancerous. This is usually done in interventional radiology. Imaging is a part of the diagnosis and care plan to the patient with liver cancer. Imaging is a part of the test that helps the doctor diagnose and locate tumors. Imaging also helps rule out if it's benign or malignant. Usually on some exams, if there is more than one tumor or if it's spread out, then that could be a sign that the tumor is metastatic. Imaging helps us know how far the cancer has spread. It also helps determine what treatments the patient should undergo. Imaging plays a big role in diagnosing liver cancer. Different modalities are used because one modality could have something better than the other modality. According to MD Anderson Cancer Center, CT shows better spatial resolution, while MRI shows better contrast resolution. An MRI can also be used to distinguish between normal tissue and cancerous tissue. So that's why different modalities are used to help diagnose liver cancer, as each modality gives different information. The role of imaging can determine if the patient can do surgery to remove it. The primary modality is MRI. When I first saw this pathology, I thought it was pretty cool to look at, and it was the only one that actually sparked an interest in me. I saw these images during my MRI rotation. This patient presents with abdominal pain in the upper right quadrant. This patient first had a CT scan and then later had an MRI scan. The images you see on this slide are axial CT views of when the tumor starts from the top of the patient going towards the bottom or towards the feet. The image on the left, you can see the upper part of the liver looking healthy, and you can see some vascular structures. The spleen is seen on the patient's left side posteriorly. Another important structure you can see is the thoracic vertebra. On the image on the right, you can see a darker circular area on the liver as the slices move inferior to the patient, meaning there is a mass located inferiorly in the liver. As we move a couple more slices inferiorly, the tumor gets bigger compared to the last image. Both of these images on this slide are the same. I just outlined the mass on the right image so you could see better if I pointed it out more. Contrast was not used for this scan, and you can tell because the aorta, vessels, and the mass is not bright, and with contrast, these structures would appear bright on these scans. The image on the left shows a coronal CT view of the abdomen. You can see the same dark shade on the lower portion of the liver. On this image, you can see the mass is located inferior to the liver. The image on the right is a sagittal CT view of the abdomen. On this view, you can see the mass is located posteriorly. In order to look into more detail about this mass, an MRI study was ordered, and these scans are axial MRI scans. Both of these images are almost the same, except for the level of the scans are different. The image on the left is around the level of L1, and the image on the right is about the level of L2. No contrast was administered for these scans, and you can tell because the aorta is not bright white along the tumor and blood vessels. These scans are axial MRI scans of the abdomen. These scans were performed with multi-hands gadolinium contrast administered through an IV. On both of these scans, you can see the aorta shining bright, and you can also see the vessels around the mass, and the vessels in the liver are also highlighted with contrast. These scans are coronal MRI scans. On the left image, the MRI tech measured the height of the mass. This tumor's dimension is 9.4 centimeters thick, 8.5 centimeters from top to bottom, and 8.2 centimeters from front to back. Under the mass, you can see the patient's right kidney, but not the left. According to this patient's history, they had a left nephrectomy. Some structures you can notice is the spleen in the upper left quadrant, small bowels, aorta, and inferior vena cava, along with the rest of the vascular structures highlighted in the liver. On the image on the right, you can see necrosis in the center of the mass. After all of these scans, the next step is to do a biopsy under ultrasound guidance and determine if this mass is cancerous. According to the report, the liver has fat and almost completely heals from ascites of previous amount of fluid identified. This pathology appears as an enhancing lesion in the arterial phase of contrast enhancement. A way you can tell if it's enhancing during the arterial phase is looking at the aorta, which is arterial. The aorta will appear bright white, which means contrast was used. Treatment will depend on the size, location, and number of tumors, how well the liver functions, if the cirrhosis is present, and if there are any other diseases present. Treatment includes surgery or to have the liver resected, which means to remove part of or all of the liver or just the portion that has cancer. Liver transplant surgery is an option when most of the liver isn't healthy enough or mostly covered in cancerous tissue or cells. Other medical procedures like radiation therapy, chemotherapy, radiofrequency ablation, and radioembolization. Radiation therapy is done when there are tiny tumors that can be removed with surgery. This treatment uses X-rays and targets the tumor and either kills or slows down the cancer cells from growing. Chemotherapy targets the tumor by using medication through the vein. Radiofrequency ablation uses radiofrequency waves and it destroys or shrinks the cancer cells in the liver with heat. This procedure usually takes 1 to 2 hours. Radioembolization is a procedure where they implant small beads of radiation into the liver's blood supply to attack liver tumors. So, can it be cured? Yes, it can. The earlier that this tumor is caught, the better treatment and outcomes for the patient. However, if it's caught late, there may be limited restrictions to what treatments can be used. Surgery and liver transplant are the best options to cure hepatocellular carcinoma. The survival rate is 21% for 5 years since the diagnosis. But it also depends on different factors, such as how advanced the tumor is or how you are responding to treatment. Focus on managing stress. Having cancer is not an easy thing to deal with. The best thing to do is relax, sleep, deep breathing, and getting plenty of rest. This can help ease the stress. Making sure you are eating healthy meals can make a big difference, as well as drinking plenty of fluids. These are my references and my sources that I use to gather all of the information needed to present this pathology. I hope you learned something from this, and I thank you for listening.